Good morning. This is Kelly Sheets with DMS. I will be your host for today's meeting. I am still admitting people into the waiting room or out of the waiting room into the meeting. It looks like we currently have five members on, and I'm admitting the sixth now, Evan Smith. So unless I've missed someone, we do not currently have a quorum.
No, 6 is not a quorum.
We need one more.
Correct.
The first thing that I heard was we need one more, and am I maybe that one more?
No, you were number 6. I'm sorry.
We tried.
Unless I've missed someone, but I don't believe I have.
Yeah.
And it looks like the waiting room is clear. So if you want to move along down the agenda and maybe come back to the minutes later, that's totally up to you, but I'm going to turn it over to you.
Right. All right. Welcome, folks. This is Steve Shannon. Just to making sure all the right places, the Persons Who Return to Society from Incarceration, TAC. We are the TAC with the longest name, I think. Roll call and introductions. Let's just confirm who we have on. At least Courtney liked my joke. So Brandon Harley's on, Adrian Bush, Van Ingram, Evan Smith, and Christian Porter are all on, and I'm on. And if you're a TAC member, you have to have your camera on, right, Kelly?
While you're voting, yes.
While you're voting,
With open meeting laws. While you're
Back to
voting.
quorum, we will not vote. So we'll postpone that till number 7 show up. All right, so on the agenda, we're down to DMS update. Leslie Hoffman, any news on our dear 1115?
Good morning. Yeah, so I'll give you what I've written it down because I don't want to leave anything out this morning. We've been kind of busy, and I have a couple of things to give you, Steve. So the incarceration amendment, CMS reached out to us, and I think there was 12 other states that they reached out to, and we met just with those 12 states and CMS to discuss incarceration amendment. Of course, we have a pending application. After California's approval, they wanted to make states aware that they are sending out another state state director letter, a Medicaid director letter. I'll get the acronym correct in a minute. They're sending that out for us to have additional guidance. They did say they had over 50 some 1115 amendments. They're not going to get through them through the end of the year. They said it would be pretty much a first come, first serve. We believe we may still be the first one that submitted that 1115. Just real quick, California's includes adults and juveniles. It includes only the 30 days prior to release. If you remember, we did pre-trial, during incarceration, and then 30-day post before leaving the incarceration. So ours is a little bit different. Also, ours is specific to SUD and California's is not. So we have a unique opportunity here in Kentucky to partner with our folks at DOC. So I just wanted to say it is moving just a tad. We are waiting for additional guidance. They said that it's probably better not to change your amendment with any substantive changes right now. Get it approved, and then you can move forward with additional changes. So we're real hopeful on the incarceration amendment soon.
Leslie, I thought California's was 90 days.
It was, I'm sorry. Ours is 30, theirs is 90. I like the 90-day idea. I've said a couple of times we probably need to boost ours up from 30 to maybe a little bit higher, but you're right, Van, I'm sorry. So California's was 90, and then ours is pre-trial, during incarceration, and then 30 days post-release. to hook up with a MCO of their choice.
But CMS, Leslie, has advised us not to make changes at this point.
Substantive changes is what they said, which that usually means don't change like your main direction, like don't change the direction we're working in right now on it being SUD and working with DOC. Like if we were like to change the population or something that would change the budget totally differently. They said that they would prefer us not to do that right now. So I am hopeful though that we could at least get started there. And then when we get the letter, then we'll probably go back and look at more of some additional populations. As you're aware, DJJ, lots of information. There's 2 bills and the Omnibus Act that also includes juveniles can be covered by 2025. So we've got like 2 bills and an act that are all kind of in the mix of our timelines right now. Our Team Kentucky
Wait a
waiver.
minute, those 2 bills,
Mhm.
are they Kentucky bills?
Yes,
Okay.
one
Just
is
checking. I can
an
get the
11.
numbers.
Yeah,
Yeah.
okay.
Now, would 90 days be a substantive change?
So I asked that the other day. We do think that would be a substantive change because of the money.
Okay.
I did ask the other day because that's one thing. Leanne's on here with me. Leanne and I started talking about that right after we submitted. We were thinking that 30 days is all that they would approve. And so we started talking about that after talking to other states, like immediately thinking maybe we want to do more than 30 days. So that's nothing in stone, but we are going to take a look at that. Let's see. I was just going to let you know that the Team Kentucky, we're still waiting for additional feedback from CMS. So you know that kind of kicks off the whole process of hoping that the incarceration amendment would be within that renewal or even before. And I've asked Leanne, are you on? Can you go over the numbers for Steve today?
Yes. Let me. So this is the numbers are as of this past Monday, 1.7 million Medicaid population, and that has increased each TAC that I have presented. And I apologize if you hear my dog barking. I'm not sure what's going on. Total incarceration Medicaid population is 20,273. And I will put this in the chat after I give the numbers. And within our KSR and KCIW, we are seeing that benefits have been turned on within 4 days of release.
So it's still not perfect, but we're definitely doing better, Steve, on the days.
Yeah. I haven't heard many questions recently.
Yeah.
Can you talk about the folks who are going through, 'cause doesn't all Medicaid eligibles, Medicaid beneficiary, I guess, have to be reviewed in the next 12 months or something?
Yeah, I can send you that information if you want me to, Steve. It's what they call the unwinding.
Yeah.
And check your current status, make sure all your information's up to date, your your email address, your home address, your telephone numbers, all those kind of things. And then it gives more links. If that's okay, I'll send that to you and you can send it out to the team.
Yeah, that'd be good. I think people are probably hearing about that or interested in knowing the ramifications. But
Yeah.
briefly, as I understand, help me with this, Leslie, it's going to be about it's over the next year, starting in April.
Mm-hmm. Yes.
So it won't be everybody in April, probably be a 12th or so in April, right?
Yeah.
Yeah,
I'll get the information. I think Veronica actually spoke on that yesterday, but I can get the information for you. But public health emergency, according to the federal government right now, is May the 11th, I believe.
Right.
End date.
Okay. Does anyone have any questions for Medicaid or questions about the unwinding? Or have you heard other things you want clarified?
Steve, I would mention that you've heard me say this many times. The number of participants on Medicaid continues to increase. As you can see, Leanne just put that in the chat. There's a little less than 4.5 million in Kentucky, and we're at 1.7. It was growing about 3,000 a week. It's slowed down just a tad, but it's amazing to me the number of folks that are on Medicaid. So just wanted to let you know we are seeing that increase. The number of children in Sky are continuing to increase. I think incarceration, Leanne's been hanging around about the same amount, or maybe even went down just a tad in the last couple of months.
It's actually grown by 200.
Was it 200? Okay, I
January.
knew it wasn't much.
I'm sorry. Yeah,
No,
about
that's okay.
230. Yes.
Yeah,
Is it
Jeff
20,000
Hadley with
incarcerated?
Humana. I just wanted to add, there are a couple different categories for that. On some of those folks, passive re-enrollment, or that's the best term I can think of. But those are the folks that are basically just going to be pushed through the system because they obviously are
Right.
eligible. And then they'll have a group that's called the active. And those are the folks where they'll really have to provide proof of eligibility.
Thanks. And Leanne, the 20,000 incarcerated, those are Medicaid eligibles?
That's the total incarcerated Medicaid population. Yes.
Okay.
I guess, Leanne, is that those are people that are active on Medicaid, or those are the people that are suspended, or what?
All the above.
Okay, so active and suspended.
Yes.
Okay.
I guess was it 3 or 4 years ago, there all of the incarcerated individuals were given a Medicaid application to complete. And then after we were caught up with everyone, then upon booking, everybody gets a Medicaid application. So everyone should be at least applying. And then, before the release, if they're still doing those pre-release classes, they're working with the connectors, thank you, sorry, to get enrolled and MCOs chosen.
Okay. Thank you. I guess I just feel like, and I knew I should have asked that question to Kristen about how many were incarcerated, and she's saying state inmates, but that I assume, Kristen, that's not jails, right? So I guess I'm still like in this like nebulous population.
No, absolutely. So,
jails,
yeah, Kentucky is one of 2 states where we do house state inmates in jails as well. So that 18,000, it does count the people in the jails and the people in the prisons. So the other people in the jails, I mean, some of the jails have county inmates, of course, and then federal inmates as well. So there are other inmates at county jails that aren't state inmates too. But that's the approximate for our state inmate population.
Okay. Sorry, everyone. I just wanted to make sure I understood the numbers.
Absolutely.
And Adrian had a question about the SMI waiver. Can you touch on that, Leslie? Where we're at, resulted in Senate Joint Resolution, I guess it was 72.
72. So we've got 2 SMI initiatives going on right now, an 1115 amendment, and there should be some public comment going out in spring. We did send a draft to CMS, and I think I've announced that before, like the last couple of days of December. We wanted to do it before the end of the year. We're still working on that. Based on Senate Joint Resolution 72 and the need for Kentucky also wanting something that looks like different levels for different levels that members might be at, maybe at the lower end of the HCBS arena, all the way up to maybe just needing some tenancy support and things like that. So we're trying to come up in our new waiver, or another waiver. This is the second waiver. It's a 1915I, and it's really more about behavioral health too. Like, I'm going to try to encompass a few things on the higher end related to homelessness. So that's it's all very exciting. That one, we're looking at having some public comment scheduled late summer of 23. I think they've started scheduling. Steve, I believe you and Dr. Schuster were able to meet with our contractor the other day, and those interviews are going fairly well. And so what in all hopes we'll end up with a 1915 I waiver that will have a variety of levels to help with housing and employment. And then we'll have an 11-15 as well. So more to come on that, but we are proceeding on that fairly, I don't know how to explain it. It's every week. We work on it every week.
Thanks for that question, Adrian. Does anyone know how many total people are incarcerated?
That was my question, Steve. Thank you.
So I can say from the Department of Corrections, of course, we track state inmates.
Right.
I can't say, I don't have statistics on like if you include county and federal inmates, you know, all that. I don't have that, unfortunately.
Does anyone collect the county number?
I mean, I know that someone probably does. I'd tell you what I can do. While we're in the middle of this meeting, I'm going to text our director of local facilities who deals with the jails and see if I can get an answer from her, or if she knows how we figure that out. Because yes, Casey, we do a weekly jail population report on the DOC website, but like I'm saying, that's only state inmates. There are other inmates at those jails. So that is not inclusive of those other inmates too.
And that's the 18,000 number, more or less.
Yeah. Let me text her real quick and I'll see if I can get that.
No, just curious.
Yeah.
See
Yeah,
where
I
we're
think
at.
what I was asking was the pretrial population, right? And so what I put in the chat is just, it's not current to now, but that's the quickest thing I could find that says 41,000 people are behind bars according to this this policy and advocacy group. And it looks like it might be in 2020 or 2021. So that would be double the population that, you know, isn't in the state.
It looks like half of those we believe are Medicaid eligible. I bet it's more than that, ultimately, once we do, right? Those are the ones we know about. All right. Anything else for Medicaid? There's another thing from Casey in the chat. That looks pretty recent, doesn't it, Casey? All right, we now have a quorum. Thank you, Mr. Sharkey. Kevin joined us. So if we could do the minutes real quick, have a motion to adopt those.
So moved.
And Ingram, do we have a second?
Second, Brandon Harley. Second.
Thank you. A little worried there. All in favor, someone saying aye?
Aye.
Opposed and extensions adopted. All right, very good. Thank you all. We can proudly report that at the MAC meeting in 2 weeks. Next, we have MCO updates. Anything going on specifically any MCO wants to add relating to this population? And let's start with Anthem.
Hey, Steve, good morning. This is David Crowley with Anthem.
Yeah.
We did have a great meeting with DOC in February to kind of discuss how we can further collaborate and also discuss any barriers that we're seeing in engaging members returning to society from incarceration. And I think those meetings will probably be kind of ongoing and as needed, but it was great discussion and we appreciate it. Anthem continues to have fairly low numbers as far as volume goes, around 3 to 5 persons per month that we're notified of returning to society. We continue to have a dedicated case manager that's reaching out to engage those folks. So appreciate all the collaboration.
Thanks, David. What about Aetna?
Hey, good morning, everyone. I just wanted to report back that we did meet with DOC, and I think that meeting was, let me pull up my notes. It was a couple weeks ago where they met with us, a case manager from Start Strong, and talked about the resources for reentry. So they had just a really nice meeting to talk about those resources and who to reach out to and and how they can get in touch. And so we just really appreciate being able to have those connections. I think honestly, when I talk to anyone from another state, like these kind of collaborations are not as easy to come by. So I just really appreciate that kind of collaboration and appreciate people being willing to meet with our MCOs to talk about this population. So thanks for that meeting.
Yeah, Steve, I think that shows the value of this TAC. You know, we learned at our last meeting, there wasn't a miscommunication between DOC and MCOs, and appreciate everybody's willingness to work together and get that straightened out. And if you're an MCO that hasn't met with DOC recently, I would encourage you to reach out to Kristen and get that set up.
All right, very good. Thanks for that, Van. What about Humana?
Good morning, everyone. Yes, the same. I just want to say I want to give some big thank yous to Christy Sorrell, Kristen Porter, Erica Hargis, and Sarah Johnson. There was a lot of emails going back and forth after this last TAC because after discussing about some of those barriers and breakdown in communication. And, you know, after all those emails and meeting a couple times, we kind of figured out it was simply a really simple issue where, you know, we just didn't have up-to-date contact information on, you know, the reentry coordinators due to staffing changes. So once we got pointed in the right direction, we know how to access that information now. I think communication is going to be much smoother moving forward. So I just want to say I really appreciate all of that collaboration with you all, just like all the other MCOs. It's been really appreciated. I know after the last TAC, we also discussed a little bit about our expungement benefit, and you know, we all discussed how that's still a barrier. So we went back and there was a lot of research that was done, and I'm actually going to turn it over to Jeff Hadley because he did a lot of research on this, on how to do some ongoing assistance for our members. Obviously, we understand that this is still a barrier for a lot of individuals, and we want to make sure that we're able to help them meet those needs. So Jeff, are you on here still?
Yes, I am. Can you hear me?
Yeah.
Yes.
Yes. Yeah, there was a question raised, or I guess a concern about our value-added benefit, one related to the reimbursement of the fees for criminal expungement. And basically the concern was, you know, we would reimburse up to $340, but someone had raised the issue that coming up with $340 for some of our members is quite a feat. And we can look back at the way that we structure that benefit. We are looking at that internally, but in addition to that, there was a Supreme Court ruling on the waiver of criminal expungement fees, and basically we've been trying to nail down exactly the process so that we can provide good information to our members on how to go about having those fees waived. The best that we came up with is the courts kind of direct a person that's making that application to contact the Office of the Courts. And so what I've done is gone ahead and contacted the Office of the Courts to try to see if they can provide us with instructions or directions that would make that process a little bit more user-friendly and lay that out for our members. So we're in the process of trying to collect any additional information that we can use to make that more accessible to folks seeking that waiver. And we'll provide that to the TAC when we get it compiled.
I just want to say, does anyone on the TAC actually have more information on this that we can share with our members?
Yeah, this is Evan Smith from Apple Red Legal Aid. So we and the other legal aid organizations have been pretty involved with this question of when the statute providing for fee waivers should and should not apply in the expungement context. And I think we have a very broad statute about fee waivers that we think should apply really across the board, including everything from the initial background checks, which the Supreme Court case that Jeff's talking about didn't directly address, to as well as the more direct fees that apply even for people that are going to be eligible for expungement, which the court did address. And so I won't kind of necessarily go into all those weeds right here, although I'm happy to kind of walk people through the process. But what I can say is that we are also very interested in making the process as intuitive and user-friendly as possible. There's a real patchwork across the state of how different judges handle these fee waivers and what they think they apply to in the expungement context. And I can say that when, whether they're someone on Medicaid or someone that comes through one of Goodwill's expungement clinics, or just someone that comes through our intake more generally, if they're able to get connected with us, we can generally kind of help people navigate the process. But for people that are trying to do it on their own, I would not expect them to be successful. And again, some judges I think are good at shepherding people and doing it the right way, but I would say that is not the general experience that people have in Kentucky. So yeah, we'd love to have a conversation and be involved with AOC and KSP and everybody else that's involved with that process to make sure that the statute is applied in the correct way, and also that it's just as simple for both the state employees that have to be involved and then most directly the people who should be eligible to get their records expunged.
Well, thank you for that information.
Yeah, thanks,
Very-
Evan.
Sorry, that's it from Humana.
Thanks. I'm trying to track comments, and they're kind of going pretty fast. We'll get back to those in a minute when MCOs are done. All right, United? Oh,
Hi,
sorry,
good morning,
Passport, I
Steve.
skipped one, my bad.
Okay.
Passport by Molina.
Yeah, like everyone else, we had a great meeting on February 21st. We discussed some successes and the barriers, which also was largely being able to get a hold of the reentry coordinators. After the meeting, Christy sent us a list of the regional coordinators and their supervisors. We also discussed some future considerations for using our statewide offices that we have for recently incarcerated individuals to provide services out of those offices. And I think that's about it.
Mark, it's Michelle Hughlin.
Yeah.
With Passport. We have reached out to those reentry coordinators that Christy provided us for each of the regions. And we have already scheduling some expungement and reentry clinics at our 5 one-stop help centers across the state.
Thanks, Michelle.
You're welcome.
Yeah. Good deal. Thank you for that. All right, now United.
Hi, good morning, Steve. It's Stephanie. Similar to all the other MCOs, we did as well. Participated in a meeting with DOC on February 28th, and to everybody's kind of comments, it was collaborative and extremely helpful. Many of the similar barriers I think all the other MCOs were challenged with was obviously contact information. So Christy did provide that information. There was a few different takeaways that I'm still waiting on follow-up and responses to, with some additional challenges with the eligibility file. I don't know, I'm sure other MCOs a lot is defaulting back to their address as the prison system and we have a lot of barriers of getting release of information to be able to talk to them post release. So I think with the corrected contact information, we hope we're going to be able to have more successful outreaches when we do receive new referrals. Since November of 2022, we've only received 3 new referrals. One of the referrals was reincarcerated, one was unable to contact. And then the last enrollment, we were able to enroll them in our intensive opportunity program and provide some medication assistance, as well as employment and food resources. So at this point, we continue to remain low on referrals as well, I think similar to the other MCOs.
Okay, thank you. WellCare.
Hi there, it's Paula McFall, and
Hey.
very much similar to what everybody else has said, we met with Christy last Tuesday on the 28th. We did receive the reentry coordinators. We talked a lot about access to information related to contacts, not just the member, but family or support systems. WellCare does has been working on a new phone access to phones. It had taken like a couple weeks to get a member a phone, and we now have case managers who have access to phones more readily. So hopefully that might help in this situation. Although with the 4-day lag in becoming a member of a health plan, that's just something to work through. But maybe we can provide the phone to the member even if they're not quite enrolled yet.
Great, thank you, Paula. And Evans offered to talk to any of the MCOs about fee waiver process for expungement, and there's his email address. Thank you, Evan.
Thank you so much, Evan. Really appreciate it.
Oh, thank you all.
Christy Porter, can you explain what you learned about the inmate count? Christian Porter, are you still there?
I am. Steve,
Okay.
what is your question? The inmate account?
Yeah, oh, the count. You put it in the
Oh,
comment.
inmate count. Sorry.
Okay,
I was like, I don't understand. Yes,
Right.
absolutely. So Kirsty said that within the past time, she didn't tell me a time frame, but what we have done, because DOC would actually get this question a lot, we have started asking the jails to report their total counts to us. So on the one report, so Casey put it in the chat, if anybody wants to click on that and see the link, they update that every Friday, she said, and that is inclusive of all inmates at the jails. The numbers, of course, DOC only verifies our own state inmates, so we don't go in and actually verify county inmates or anything like that, but that's what the jailers report to us. So if you look on that link that Casey had put in the chat, as of February 16th, there was almost 32,000 inmates in the state collectively.
Okay.
And then again, I don't think this is generally probably the federal inmates wouldn't particularly be eligible for the Medicaid that we're talking about, but that 32,000 does not include the federal inmates, right?
It includes the federal inmates that are at a county jail. So it does include that, but there are federal prisons in the state as well. But yes, if there is, but it does, if you look on the report, it has the column there that says federal. And so, I mean, it would be easy just to take those numbers out of the 32,000, of course.
Okay. So about 2/3 of those are Medicaid eligible. Yeah, we know of. Thanks for that, Kristen.
Absolutely.
See where we're at. All right. Appreciate the MCO updates as well. That's good information. I'm glad y'all got together with DOC. Maybe we can kind of do some upstream work, right? Round robin. I'll start off with House Bill 248. This is actually a recovery housing legislation that creates some standards. There's a National Association of Recovery Residents that has standards. I'm going to follow up on those, apply those. I agree, Courtney, it is a great bill. There needs to be some structure to these. Language was added that if it's a religious affiliated with the church in the county or the nearby, they will not have to meet those standards. I think ultimately they will move towards meeting those standards because everyone else will. Our experience that the rationale for this bill really came out of Elizabethtown, and the chief of police and the mayor both said, we have some how they perceive as maybe not doing a great job with their recovery residences. So this is an opportunity. Obviously, this is a key step for a lot of folks as they return, whether in recovery. Some people go from treatment to recovery housing. Thanks for that link, Courtney. Other could easily end up, go to a halfway house and recovery house from, returning to society from incarceration. So I think this sets some standards. I would say that, some recovery houses are doing a great job and others are aspiring to. I don't always know if they're aspiring to. So I think this is a big first step. Anybody else? Adrian, what about your ID bill?
So glad you asked, Steve. House Bill 21, as mentioned last meeting, was filed. It has passed the House 94-0. And it is in the Senate. It is awaiting Senate committee assignment. We believe it will be assigned to Senate transportation since it went through House transportation. And yeah, literally nobody has a problem with this bill. It's just making sure it doesn't get lost in the shuffle.
Amen.
Yes.
Sometimes bills with no problems are challenging.
Yes. So anyway, that's
Good
the
deal.
status on that. But yeah,
Good.
it should pass.
Yeah.
It's just,
Remind us again what
I
it
wanted
does.
it done like, back in February because I'm
Yeah.
impatient. So
Give us a brief summary. Yeah.
yeah, so briefly, it streamlines the process to obtain a state issued ID for people experiencing homelessness. We do have a way right now to obtain that ID, but this bill would make some key reforms. One being reducing the cost from $10 to $5 for a 1-year ID, and allowing agencies who work with this population to enter into billing arrangements with the department, with the cabinet, transportation cabinet, because, when we're thinking about particularly homeless shelters in higher population areas like St. John Center, they're issuing a $10 check here, a $10 check there, and it would be more efficient, right? Another key provision is that it would allow 16 and 17-year-old unaccompanied minors meeting the federal definition of homelessness. And that includes kids who are doubled up, couch surfing, etc., to obtain a state issued ID, even though they're technically, under the 18. And then lastly, it would allow people who had a driver's license, an operator's license, if their date of renewal falls while they're experiencing homelessness, to be able to renew that driver's license. And instead of driving illegally or having to get a state issued ID without the ability to drive legally. So, and since, there's a common perception that, all people experiencing homelessness are not working, don't need to get places, that sort of thing, that we know that isn't true. So anyway, those are the things it would do.
All right. Stuart Owen says bravo for House Bill 21.
Thanks, Stuart Owen.
I've been tracking other bills, was not aware of this. This is a awesome bill. Good luck getting it over the finish line.
Yeah, I think we'll get there.
Good deal.
Yeah, Steve, you mentioned 248.
Yeah.
Well, you're talking about a bill that's vastly improved through the process.
Yeah.
The original draft was not good. Hats off to Gene Deatherage and the Kentucky Recovery and Housing Network that have really worked on a lot of compromise and got this down the road.
Yeah.
House Bill 353 passed out of the House 93-0 yesterday. That's the bill that takes fentanyl test strips out of the definition of drug paraphernalia. It also creates an exemption that if trace amounts are found on a fentanyl test strip that does not meet the standard for possession of fentanyl. Also requires CHFS and my cabinet, the Justice Cabinet, to do a fentanyl education and awareness campaign. So it's a good bill. Hopefully we'll get it heard in the Senate next week and can get it passed. It's not every day that you have the ACLU and the Kentucky Chiefs Association at the table together. So that's fun to see.
Yeah. Thank you, man. Anybody else?
I just wanted to add, Steve, from DOC's perspective, we were very happy with how all of the MCO meetings as well, it went as well over the past couple of weeks, and really appreciate everyone, kind of voicing what was going on and sharing that with us. This, as we all, I think, know and kind of remember, this original collaboration, it was a good 5 years old, and like any good original collaboration, you have staff turnover that happens and everything. So I think it was a very needed kind of eye opener for us at DOC to say, oh wait, some of this has dropped off. So I really wanted to just say thank you, and you really kind of letting us know everything that was happening so we can kind of look into things on our end as well. So I appreciated that.
Yeah, great. It was a good thing, it sounds like.
Absolutely.
So any other round robin updates? Mr. Ingram, you give us the Senate Bill 90 from last session update, maybe? I think it bears on what we do here, right, Van?
Yeah, we have a Senate Bill 274 that's kind of a cleanup to last year's Senate Bill 90. The definition that we came up with, the requirements for providers, kind of leaves out FQHCs and leaves out some other key providers that would fit in this program. So 274 is a cleanup to that. It's awful late in the session, so we're going to be looking for another vehicle to attach that to. But we do need to help with that language. Right now, without that change, we don't have enough providers to implement this bill the way it should be. So we really need to get that done, especially in Letcher County where they have a very active FQHC doing SUD treatment. We do have a contract in place with the Fletcher Group to do some data collection and some other things related to Senate Bill 90. And we'll come back together and after this session in April and start the process of trying to add more counties. Right now, we just have Letcher and Kenton. But we didn't get the funds that were promised to us. We didn't get those until late January. So it was really hard to move forward with the checks in the mail. Because I've been around this town a long time. Sometimes you think you have money and then it doesn't show up. So we really weren't going to proceed forward with much of anything until we had those dollars in hand.
All right, thank you, Van. Anybody else?
I have a question, but I don't know if this is the right place to ask it.
Well, let's find out.
Okay, so I guess we mentioned, DMS, I think it was Leanne that mentioned the sky population earlier. And so Edna is in charge of the sky population. So I was wondering if does DJJ need to be in this TAC? I was just wondering if it's specific to adults, great. Adults starts at 18, right? We have 18 to 26. We also have that group in our transition age youth, but I was just wondering, because we're not including DJJ in any of our numbers and things like that. And I know the Medicaid eligibility for DJJ is very, for lack of a better term, messy. So I just didn't know if that was something we needed to talk about or something that had already been discussed, since I don't know if I've been to every TAC.
One, Courtney, has not been discussed. I don't think, not that, we haven't discussed it here. And when this TAC was created, legislation probably in 2020, if I remember correctly, DJJ was not included at that point. But it does raise an interesting question, does it make sense to include DJJ? And we'd have to figure out, it's kind of late in the session, if we could find a bill to do that. One, are they interested in participating? One, I think we need to do, and maybe the answer, I suspect maybe Van can help us with a connection there of DJJ.
I think it might be good to invite them, get them participating anyway, even if we can't get them named to the TAC right now.
Right. I mean, we're trying to keep it as loose as we can and kind of an open discussion. So I think that would make sense to have obviously DJJ is getting a lot of attention right now. But I
You
think
could say that, yeah.
it's just a piece that just a little bit, right, Van? It's just, I think it's a good suggestion, Courtney. So Van, if you could do that.
I will. I will get us the right contact.
Okay.
Steve, this is Leslie. If I could just mention,
Yeah.
since we got the incarceration amendment submitted to CMS, and I know that's been almost 2 years ago, or it has been 2 years ago, we immediately started working with DJJ because the incarceration amendment was kind of going to be the starting point. To the next step was going to be to work with DJJ, and that was prior to all the bills and the Omnibus Act. But I just wanted to mention that at some point it might be a good idea to pull them in. Just like that you all feel, I think it would probably be a good idea.
Leslie, who do you work with over there?
Stacy and Veronica Kuntz.
Yeah.
There, when we started, there was a different commissioner there, and they left. And one of the reasons that we held off just a short period of time is we were looking at SUD in the with the incarceration amendment, and so DJJ was in the middle of trying to revamp their curriculum for the children that would receive services during confinement. And I think they had reached out to a evidence-based practice group in Cincinnati. But again, that's all. I just wanted to say we actually worked for months working with them until we decided to put it on hold just for a little while until we could see if CMS was going to approve the incarceration amendment. That's it.
Okay. But I think if we could just reach out, I think it'd be good to invite and have them involved in the conversation. And, if they're interested in being a member, we'll figure out how to make that happen, whatever the next step would be. But they're obviously welcome to join.
Thank you.
That's a good recommendation, Courtney. Now, we talked earlier, the TACs can make recommendations to the MAC. And we've been meeting a while now, and we haven't gone to that place yet. Other TACs make recommendations and to the MAC, and the MAC sends those on up, Leslie, right, to Medicaid, and Medicaid responds to them, right? So I don't know if it would make sense, and you can advise us, Leslie. A good recommendation might be that if we can, we change it from 30 days to 90 days. Just to go on record that we would support that change. And this will probably shock people. The A is advisory. I would anticipate the response might be, pending further discussions with CMS, we will pursue this, what we consider a substantive change. But just let us go on record as saying we think the 90-day time frame is more effective than 30 days. And go on from there. Does that make sense to folks?
Yes, I would ask you, Steve, just to give us a little bit of flexibility, because Leanne and I were kind of in the middle of that, and would that kind of wanted it to be more than 30 days for sure, but don't know if we need 90. So we were just kind of figuring, like Leanne and I had talked to some other states there that were looking at 60 at the time. So just give us a little bit of flexibility there, but whatever you need to do, I'll address anything that you want me to.
Right.
You don't want to see anything back.
How about a recommendation? We need a motion in a second from TAC members, but just thinking about this, it would along the lines of the 1115 incarceration waiver. Does that work for you? That give you enough information, Leslie? Look at the time frame for initiating Medicaid coverage to occur greater than prior to 30 days of a release date. So that allows you to at least look at it if it's 60 or 90.
We could revisit it for sure.
Greater than 30 days, but less than 90, or, up to 90 days. I think that's a window. I would feel better having the 90-day in there, just so we can at least, we think the 90 days is a better number, right? But just some conversation. So essentially, and we'll draft this motion and send it in, and I'll report that at the MAC in 2 weeks. That's how the process is. But the motion will be that pending that through the waiver process for the persons returning to society from incarceration, that the time frame for Medicaid benefits being turned on occurs greater than but less than 90 days prior to release date. Does that make sense to folks?
Yeah, don't put a time frame on, because I have no idea when they're gonna approve it, so if.
No, I'm not saying that. I'm
You know
saying-
that, sometimes I
Yeah,
get
but
bills that
time
say do it in
yeah,
30
because I don't want to
days.
make a recommendation that
Yes.
we'd have to come back and
Yes.
revisit.
Okay.
But this recommendation
He froze.
there she's
Okay.
back, right? Essentially,
You need to go back and repeat that, Steve. You froze up there for a minute.
oh, I froze it. Okay. My internet connection is unstable. So anyway, can you hear me now? Am I
Yes, sir.
stable? The recommendation would be that Medicaid benefits for people currently incarcerated would be turned on at least 30 days prior, but no more, not greater than 90 days prior to release date. Does that work for folks? Can you all hear me?
Yeah, I'll make that motion. Steve.
Yes,
All right, so
Second.
Dan makes the motion,
I'll second.
and who is that?
Kristen Porter.
Krista Porter, thank you, just making sure. All right, all in favor signify by saying aye.
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 Opposed? Motion carries. All right, that is our first motion. I think we'll have a certificate, maybe a plaque. Go on from there. All right, folks, well, I appreciate that. Any other topics you want to talk about today? All right, thank you all. We'll see you on May 11th. And hopefully by then, maybe we'll have DJJ join us.
Okay.
Super. Thank you all.
Thank you all.
Take care. We'll see you.
Everybody have a
Thank
good
y'all.
day.
Yep. Bye-bye.
Bye.